Welcome to your HSI training program. To navigate this course, click a lesson title from the lesson menu to begin the lesson. Click the arrow to advance to the next frame. Click the checkmark button to submit your answers, then click the arrow to advance. Click the home icon to return to the lesson menu. The goal of an adult first aid and/or CPR AED training class is for participants to gain or improve knowledge and skill proficiency in adult first aid and/or CPR AED for the adult, child, and infant. A student book is available for download for all training participants to assist students in gaining and retaining knowledge and skill competency. To download the most current student book, select the open document. Return to this browser window to continue training. Certification requires that you successfully complete this online class and the hands-on skill performance evaluation or evaluations for the class type, conducted by a currently authorized HSI instructor. Understanding the class goal is an important first step toward clearly communicating expectations to students. After completing this lesson, you should be able to explain the goal of the class, define first aid provider, and conventional CPR.
Medical emergencies can happen anywhere at any time. Thousands of workers die on the job, and millions of workplace injuries and illnesses occur in private industry every year. There are over 100 million emergency department visits in the United States annually, 35 million for injuries alone. While some of these injuries and illnesses can be treated, prevention of illness and injury is always better. A healthy lifestyle, combined with a commitment to safety at work, home, and play, can prevent many needless disabling injuries, illnesses, and deaths. However, once an injury or sudden illness has occurred, effective first aid can save lives, prevent permanent disability, and improve recovery. Trained first aid providers have a vital role in delivering this care during the first minutes of a medical emergency, before emergency medical services or EMS providers arrive and take over. This course is intended for individuals who desire or are occupationally required to be trained in first aid for adults and/or conventional cardiopulmonary resuscitation and automated external defibrillation for the adult, child, and infant. The purpose of this training program is for participants to gain or improve knowledge and skill proficiency in adult first aid and/or conventional CPR and AED. First aid is the initial care provided for an acute illness or injury. The goals of first aid include preserving life, alleviating suffering, preventing further illness or injury, and promoting recovery. First aid can be initiated by anyone in any situation, including self-care. A first aid provider is someone trained in first aid who can recognize, assess, and prioritize the need for first aid, as well as provide care by using appropriate skill competencies. A first aid provider recognizes their own limitations and seeks additional care when needed. Conventional CPR is an emergency procedure that combines chest compressions with artificial ventilation to circulate oxygenated blood to the brain and heart, increasing the possibility of successful resuscitation. It is performed by a trained CPR provider. A first aid provider may or may not be trained in conventional CPR, and a CPR provider may or may not be trained in first aid.
Complete this review question to check your knowledge. There are relevant legal concepts that all first aid and/or CPR providers should be familiar with. After completing this lesson, you should be able to summarize the basic legal concepts that apply to providing adult first aid and/or CPR AED.
There are relevant legal concepts that all first aid and CPR providers need to be familiar with. Duty to rescue is a concept in law that refers to the duty of a person to rescue another who is in a dangerous situation. In the U.S., in general circumstances, there is no duty to rescue. A person cannot be held liable for doing nothing while another person is in peril. However, there are certain situations where a person may have legal duty to provide aid to an ill or injured person. For example, the driver of a vehicle involved in a crash resulting in an injury or death of any person would have that duty. Some people, by the nature of their occupation, have legal duty to provide first aid. This includes firefighters, law enforcement officers, lifeguards, school teachers, and others. A Good Samaritan is defined as one who voluntarily renders aid to another in distress, although under no duty to do so. All 50 states and the District of Columbia have statutes that provide immunity from liability for people who assist others, called Good Samaritan laws. They are intended to encourage people to help others in an emergency without having to worry about being sued. Good Samaritan laws generally apply to any person who voluntarily comes to the aid of an ill or injured person and acts as an ordinary, reasonably prudent person would have acted under the same or similar circumstances. Although these laws vary from state to state, they typically require these circumstances to apply. The situation is an emergency. Any aid is voluntarily given. The victim must give consent whenever possible. The aid must be given free of charge and in good faith. The aid cannot be grossly negligent. Grossly negligent means a lack of care that demonstrates a reckless disregard for the safety or lives of others, which is so great it appears to be a conscious violation of other people's rights to safety. It is more than simple carelessness. To provide first aid care for someone in an emergency, you must have their consent, meaning their approval or agreement.
Oh yeah, please, help.
Okay. Consent comes in two forms, expressed or implied. Expressed consent can be given verbally, in writing, or non-verbally. For example, when a person nods their head to agree when asked, "May I help you?" Don't touch or give first aid to a conscious adult who objects to it. Consent is implied when circumstances would lead a reasonable person to believe that consent would be given, but it was not directly expressed. Implied consent in an emergency usually occurs when you're unable to communicate with a person, such as if someone is unresponsive. The assumption is that they would ask for help if they were able to. Employers are legally obligated to keep certain employee records private. For example, the Americans with Disabilities Act requires employers that have disability-related medical information about an employee treated as a confidential medical record. However, this information may be disclosed to first aid and safety personnel when appropriate, if the disability might require emergency treatment. If you learn confidential medical information in your role as a first aid provider, it is your responsibility to keep it confidential. To be abandoned is to be left without needed protection, care, or support. Although there is generally no duty to rescue, once you decide to help, you should not abandon the victim. Stay with them and continue to care for them until someone with equivalent or higher training takes over for you.
Complete this review question to check your knowledge.
Okay. Implied consent usually occurs when consent is given
verbally. Consent is given in writing. You are unable to communicate with the person. Yeah. Yeah. Home.
A trained first aid provider must be able to recognize, assess, and prioritize the need for first aid. Doing so requires being able to recognize life-threatening conditions. There are situations where time is of the essence, and delays can lead to serious, even fatal consequences. After completing this lesson, you should be able to recognize the first aid and/or CPR provider's role, responsibilities, and priorities.
A trained first aid provider must be able to recognize, assess, and prioritize the need for first aid. Doing so requires being able to recognize life-threatening conditions. There are situations where time is of the essence, and delays can lead to serious, even fatal consequences. Life-threatening conditions include unresponsiveness, severe external bleeding, shock, altered mental status, difficulty or no breathing, choking, stroke, and chest pain or discomfort. Other warning signs and symptoms of a life-threatening condition include coughing or vomiting blood, persistent vomiting, head injury, seizures, poisoning, severe allergic reaction, or major broken bones. Recognizing the signs and symptoms of a life-threatening condition and taking quick, effective action can potentially save the life of a loved one, a colleague, a stranger, and maybe even yourself. A trained first aid provider must provide care using appropriate skill competencies. Skill competency in first aid is the ability to use first aid knowledge and skills confidently and effectively. Learning, practicing, and using step-by-step procedures for handling life-threatening conditions will help you develop competency in first aid. Recognizing your limitations means acknowledging the limits of what you know and what you can do. Failing to recognize your limitations has the potential to cause harm. A first aid provider should never go beyond the knowledge and skill competence they have learned and demonstrated in training. Know your limits and seek additional professional help when needed.
Complete this review question to check your knowledge.
Being able to access and prioritize the need for first aid requires being able to
Assessment of the scene and the person is a critical skill that applies in any emergency. The steps of the assessment are crucial in all but the most minor circumstances. Due to the risk of infection, proper removal of contaminated gloves is imperative. After completing this lesson, you should be able to identify the assessment steps.
Trained first aid and CPR providers should follow established procedures for first aid, CPR, and AED. This step-by-step guidance for performing first aid and CPR is based on scientific evidence, national guidelines, and the consensus of experts. There are different procedures for first aid and CPR depending on whether the person affected is an adult, child, or infant. The action you take also depends on your training as a first aid provider, a CPR and AED provider, or both. As such, the procedures you will learn in this class depend on your first aid, CPR, and AED training needs. When an emergency occurs, it may not always be clear at first what kind of care the person needs. If you are a trained first aid, CPR, and AED provider, you will follow that procedure. If you are only trained in first aid, you will follow that procedure. These procedures list actions in sequence, but in a real emergency, they may need to be carried out in a different order or performed simultaneously when multiple providers are available. Although there are separate procedures for first aid, CPR, and AED, the first steps are always the same. There are 5 main elements to the procedure for first aid, CPR, and AED. Assess scene safety. Take standard precautions. Assess responsiveness. Activate EMS and/or your emergency action plan. Send someone to get the first aid kit and an AED. Assess breathing for no more than 10 seconds. Emergency scenes can be dangerous. Your personal safety is the highest priority even before the safety of an ill or injured person. Always pause for a moment before approaching. Look for obvious hazards and consider the possibility of hidden dangers. If the scene is unsafe, do not approach it. Activate EMS or your emergency action plan. It is best not to move an ill or injured person at all, especially when you suspect a spinal or pelvic injury. You should only move a victim when there is an immediate danger and you are able to take action without placing yourself at unreasonable risk. If you decide it is necessary to move someone, the most effective emergency move is a drag. When using a drag, pull in the direction of the long axis of the body to keep the spine in line. Never pull a person's head or pull a person's body sideways. Use your legs, not your back, and keep the person's weight as close to your body as possible. Avoid twisting. Consider if you can safely move the person based on your physical ability to avoid hurting yourself. Common drags include the extremity drag, performed by grasping and pulling on the ankles or forearms. The clothing drag, performed by pulling on a person's shirt in the neck and shoulder area. And the blanket drag, performed by rolling a person onto a blanket and dragging the blanket. In this program, take standard precautions means use appropriate personal protective equipment, or PPE. PPE is equipment worn in the workplace to minimize exposure to hazards that cause serious injuries and illnesses, such as blood or airborne organisms that can cause disease. During infectious disease outbreaks, take extra care to avoid exposure to potentially infectious bodily fluids, droplets, and airborne particles. Use appropriate PPE for the circumstance. Avoid unnecessary direct contact and limit the number of first aid providers near a potentially infectious person. Depending on your role as a first aid provider, appropriate PPE may include gloves, goggles, or face shields, surgical masks, gowns, respirators, and CPR masks. Practicing putting on and taking off PPE, also called donning and doffing, is critical for your safety and to minimize potential delays in emergency treatment. If you're a designated first aid provider in your workplace, training and practice in donning and doffing PPE according to the program established by your employer is required by state and federal occupational safety and health regulations. At bare minimum, you should wear gloves and eye protection while giving first aid. They will help prevent exposure to potentially infectious body fluids, such as blood, saliva, and vomit. Due to the risk of infection, proper removal of contaminated gloves is imperative. Avoiding bare skin, pinch the glove at either palm with the gloved fingers of the opposite hand. Gently pull the glove away from the palm and up towards the fingers, turning the glove inside out without snapping. Gather the glove you just removed with your gloved hand. Carefully slide your bare index finger inside the wristband of the gloved hand. Gently pull outwards and down, inverting the glove and trapping the first glove inside. Place contaminated gloves in a biohazard waste bag or as directed by your employer's bloodborne pathogens or PPE program. Wash your hands immediately after removing gloves. Follow these 5 steps every time. Wet your hands with clean running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Scrub your hands for at least 20 seconds. Rinse your hands well under clean running water. Dry your hands using a clean towel or air dry them. If soap and water are not readily available, use an alcohol-based hand sanitizer that contains at least 60% alcohol, and wash with soap and water as soon as you can. If the scene is safe, assess for responsiveness. A responsive person will give an answer or react to you easily or readily. A responsive person can express their consent or refusal to be helped. If the victim appears unconscious, tap them and ask loudly,
"Hey!
Are you okay?"
Are you okay?"
If they do not move, speak, blink, or otherwise react in a normal way, consider them unresponsive. Consent to help is implied when a person is unresponsive. If the person is unresponsive, or if you recognize the signs and symptoms of a life-threatening condition in a responsive person, or you are just unsure, call 911 to activate EMS using a mobile device, or activate your occupational emergency action plan. EMS dispatchers, also called telecommunicators, have the responsibility to prioritize emergency calls using information provided by the caller. They notify and dispatch the appropriate responders and offer first aid instructions to callers. When you activate EMS, listen to and follow the dispatcher's instructions. Answer questions as clearly and concisely as you can. Turn on the speaker function of your mobile phone so you can listen to the dispatcher and provide first aid following their directions at the same time. An Emergency Action Plan, or EAP, is a written document required by certain Occupational Safety and Health Administration standards. The purpose of an EAP is to facilitate and organize employer and employee actions during workplace emergencies. Emergency action plans take into account the specific layout, size, and features of a particular worksite. As a trained first aid provider, you must know how to activate your EAP at work. It might be just calling 911, or you may have to use an internal phone number, intercom, public address system, or a specialized emergency notification system. If you find yourself in the midst of a medical emergency alone, or with no or limited first aid equipment, call 911 to activate EMS using a mobile device, or activate your EAP. Listen to and follow the dispatcher's instructions. After activating, and unless they are readily available to you, send someone to get the first aid kit and AED. The first aid kit should meet or exceed the minimum requirements for workplace first aid kits and supplies. Both the first aid kit and AED should be able to be obtained quickly and easily from a well-marked, designated location. Assess the person's breathing for no more than 10 seconds. Look at the chest and face for signs of normal breathing. Normal breathing is effortless, quiet, and regular. Take action based on the person's responsiveness and breathing. If the person appears responsive, obtain consent. Introduce yourself and ask, "May I help you?" If the person is unresponsive and breathing normally, maintain an open airway. The airway is a passage by which air reaches a person's lungs. When an unresponsive person is lying flat on their back, decreased muscle tone and the pull of gravity causes the base of the tongue to obstruct the upper airway. Without an open airway, the person cannot breathe. Their heart will stop within minutes. The recovery position uses gravity to keep the tongue from blocking the airway and allows fluids to drain from the mouth. Place an uninjured, breathing, unresponsive person on their side in the recovery position to help protect the airway. Place the arm nearest you up alongside the head. Bring the far arm across the chest and place the back of the hand against the cheek. Grasp the far leg and pull it up so the foot is flat on the ground. Grasping the shoulder and hip, roll the person toward you in a single motion, keeping the head, shoulders, and body from twisting. Make sure the head ends up resting on the extended arm, and roll far enough for the face to be angled towards the ground. Make sure there is no pressure on the chest that might restrict breathing. Regularly reassess the person's responsiveness and breathing. If an unresponsive person is not breathing normally or only gasping, immediately start CPR, beginning with chest compressions. Individuals not formally trained in CPR should perform compression-only CPR, chest compressions without artificial ventilation. Artificial ventilation is known as rescue breaths, which are provided by blowing exhaled air through a CPR mask. Compression-only CPR is a simplified form of adult CPR for the untrained bystander. Deliver compression-only CPR by pushing hard and fast on the center of the chest. Compression-only CPR isn't appropriate or recommended for children. Trained CPR providers who are able should perform conventional CPR. Conventional CPR combines chest compressions with artificial ventilation to circulate oxygenated blood to the brain and heart.
Complete this review question to check your knowledge. Cardiac arrest is among the leading causes of death in the United States and worldwide. Sudden cardiac arrest, SCA, can happen with little or no warning. After completing this lesson, you should be able to describe sudden cardiac arrest, SCA, and its treatment. Explain the adult chain of survival concept.
Cardiac arrest is the loss of the heart's ability to pump blood through the body due to an inadequate or absent heartbeat. Cardiac arrest is among the leading causes of death in the United States and worldwide.
I love the spaciousness of it. It fits our family.
Awesome, great.
But we just need to talk a little bit about the price.
Okay.
Just can you guys talk and drop the price at least a couple thousand?
A couple grand.
If you can do it, we'll take it home.
I really don't know if I can do that. I can't promise anything, but let me go talk to my sales manager.
Please.
Okay.
The
Yeah,
most dramatic
appreciate that.
occurrence, sudden cardiac arrest, or SCA,
Okay.
can happen with little or no warning.
Here? Are you okay?
Sudden cardiac arrest occurs when the normal electrical impulses in the heart cause it to beat too quickly, inefficiently, or in an unsynchronized manner. When the lower chambers of the heart beat too quickly or quiver, the heart cannot pump blood. These abnormal heart rhythms are known as pulseless ventricular tachycardia and ventricular fibrillation. Blood flow to the body, along with the oxygen it carries, abruptly stops. Within minutes, brain cell death starts to occur from the lack of
Are
oxygen.
you alright?
Victim of SCA may suddenly collapse.
Honey, are you okay? Somebody please, get some help. Are you okay, honey?
Ma'am, I'll be right there.
Please hurry.
Occasionally, SCA victims will experience 10 to 20 seconds of seizure activity when the brain stops receiving oxygen. Normal breathing stops. Abnormal gasping may last for several minutes.
Jack! Jack, wake up. Jack!
Hey, buddy, you okay? Buddy, you alright?
Jack!
Alright, we're gonna have to activate the emergency action plan. Get me an AED and a first aid kit.
CPR is the immediate treatment for suspected SCA.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18.
CPR can restore limited oxygen to the brain and other vital organs through a combination of chest compressions, an open airway, and rescue breaths. However, CPR alone is not enough. The most effective way to end pulseless ventricular tachycardia and ventricular fibrillation is defibrillation using an automated external defibrillator, or AED, with electrode pads adhered to the chest.
Pull red handle to reveal pads. Look at pictures on pads.
An electric shock passed through the chest may restore the heart's normal contractions.
Do not touch patient. Analyzing heart rhythm. Clear. Press flashing button. Shock.
Immediate high-quality CPR and early defibrillation with an AED can more than double the likelihood for survival. These two elements are parts of the adult chain of survival, a series of 6 interdependent links that describe the best approach to cardiac arrest care. Each link in the chain is essential for the most positive outcome. If a single link is missing, the chances for survival are greatly reduced. The chain of survival consists of early recognition of cardiac arrest and prompt activation of EMS, immediate high-quality CPR beginning with chest compressions, early defibrillation with an AED when indicated, effective advanced life support treatment, effective post-cardiac arrest care at a hospital, and recovery. The greatest chance for survival exists when all the links of the chain of survival are strong. Early recognition of SCA and activation of EMS or an emergency action plan gets help coming right away. Immediate high-quality CPR improves the victim's chance of survival by providing oxygen to the heart and brain. Attaching an AED as soon as it becomes available speeds up time to defibrillation if indicated. Effective advanced life support treatment with a focus on return of spontaneous circulation, or ROSC, and transport to a hospital for all persons with a chance of survival supports the most favorable outcome. Effective post-cardiac care, including monitoring and the use of medication, helps prevent the return of cardiac arrest and improves the likelihood of long-term survival. Recovery supports the person's physical and emotional needs that are ongoing after hospital discharge.
Complete this review question to check your knowledge. Assessment of the scene and the person is a critical skill that applies in any emergency. The steps of assessment are crucial in determining the provider's next actions. If an unresponsive person is not breathing normally or only gasping, immediately start CPR, beginning with chest compressions. High-quality chest compressions are the foundation of high-quality CPR. After completing this lesson, you should be able to identify the adult assessment steps.
As a single CPR provider, first assess scene safety. Before anything else, pause to make sure the scene is safe for you and the victim. If the scene is not safe, do not enter it until hazards have been minimized or eliminated. This includes taking standard precautions. If the scene is safe, assess responsiveness.
Are you okay?
Tap the victim and ask loudly, "Are you okay?"
Hey, are you okay?
If the person is unresponsive, call 911 to activate EMS using a mobile device or activate your EAP.
Please activate emergency response.
After activating, and unless they are readily available to you, send someone to get the first aid kit and an AED. Look at the person's chest and face for signs of normal breathing. Normal breathing is effortless, quiet, and regular. Look for the chest to rise and fall. Weak, irregular gasping, snorting, snoring, or gurgling sounds are known as agonal breaths. This is not normal breathing. It is a sign of cardiac arrest. If an unresponsive person is not breathing normally or only gasping, immediately start CPR, beginning with chest compressions.
High-quality CPR is the primary influence on survival from cardiac arrest. High-quality chest compressions are the foundation of high-quality CPR. External compression of the chest increases pressure inside the chest and directly compresses the heart, forcing blood to move from the chest to the lungs, heart, brain, and the rest of the body. When chest compressions stop, blood flow decreases significantly. When compressions start again, it takes several compressions to restore blood flow. The more times chest compressions are interrupted, and the longer the interruption, the less the blood flow to the brain, heart, and other organs. Minimal interruption improves blood flow. CPR should be performed where victim is found, as long as it is safe to do so. To deliver adult chest compressions, position the person face up on a firm, flat surface. If the person is face down, carefully roll them over. Position yourself at the person's side, kneeling close to one side of the chest. Place the heel of one hand on the center of the chest, on the lower half of the breastbone. Place the heel of the other hand on top and parallel to the first. Interlock your fingers if necessary to keep them off the chest. Alternatively, you can place one hand on the center of the chest and use your other hand to grasp your wrist for support. Position your shoulders directly above your hands and straighten your arms to lock your elbows. Push hard and deep, straight down, using your upper body weight to compress the chest at least 2 inches, or 5 centimeters. At the end of each compression, lift all your weight off the person's chest, allowing it to completely recoil or rebound to its normal position, but do not lose contact with the chest. Complete chest recoil allows the heart to refill. Avoid leaning on the chest between compressions. Push fast. Compress the chest at a rate of 100 to 120 compressions per minute. A CPR feedback device transmits information on compression rate, depth, and recoil. Providers can significantly improve chest compression quality by adjusting technique based on data from a feedback device. Using a CPR feedback device is shown to improve outcomes and is recommended during CPR training and in real-life resuscitation attempts.
Complete this review question to check your knowledge.
You're a trained CPR provider responding to a request for assistance on your two-way radio for a warehouse associate who passed out. We see a motionless person lying face up on the fulfillment center floor. The scene is safe. You have disposable gloves and a CPR mask. You tap the person and ask loudly, "Are you okay?" There is no response. Your EAP has activated EMS. Another provider is bringing an AED. The person is making snoring sounds and gasping. What do you do? Let's see here. They're motionless, but they are snoring and breathing. I'm going to go with assess for life-threatening. Oh. Yeah, because I knew it wasn't the give 2 rescue breaths, and I knew it wasn't that, so it had to be one of these two. So, home.
Rescue breaths are critically important in CPR, as they provide life-sustaining oxygen and ventilation directly to the person's lungs. After completing this lesson, you should be able to explain the importance of adult rescue breaths, explain how to open the adult airway using a head tilt chin lift.
Rescue breathing is artificial ventilation of the lungs. It provides oxygenation of the blood and removal of carbon dioxide. It is an important component for successful resuscitation. Conventional CPR with rescue breathing should be performed by all trained CPR providers who are willing and able. Rescue breaths are critically important in CPR as they provide life-sustaining oxygen and ventilation directly to the person's lungs. To give rescue breaths, there must be an open airway. The airway is the only path for getting air into the lungs. The tongue is connected to the lower jaw. Lifting the jaw forward pulls the tongue away from the back of the throat, relieving the obstruction and opening the airway. To open the airway with the head tilt chin lift maneuver, position yourself at the person's side. Place one hand on their forehead. Place the fingertips of your other hand under the bony part of the lower jaw, near the chin. Apply firm, backward pressure on the forehead while lifting the chin upward. Avoid pressing into the soft tissue of the chin with your fingers, as this can also obstruct the airway. Leave the mouth slightly open. In addition to caring for SCA persons, CPR providers may provide care for victims of secondary cardiac arrest. Secondary cardiac arrest is different from sudden cardiac arrest because it results from a problem originating outside of the heart. For example, when the person stops breathing from a drug or alcohol overdose. CPR providers can give rescue breathing using their own exhaled breath and a CPR mask. Room air contains about 21% oxygen. Exhaled air contains between 16% and 17% oxygen. This exhaled oxygen is enough to support life. Some CPR masks allow you to attach a high-efficiency particulate air, or HEPA filter, to provide further protection during CPR. The HEPA filter fits between the valve and mask, in the path of the exhaled air. HEPA filters can trap airborne virus particles. To use a CPR mask, position yourself at the person's side. Place the mask flat on the person's face with the top of the mask over the bridge of the nose. Use your thumb and forefinger to provide uniform pressure around the top of the mask. Use the thumb of your other hand, lifting the chin to control the bottom of the mask. Hook your fingertips of the hand controlling the bottom of the mask under the bony ridge of the jaw. Open the airway with a head tilt chin lift maneuver. Lift the person's face up into the mask to create an airtight seal. Give a rescue breath by blowing through the valve opening. Each breath is 1 second in length. Give enough air to create a visible rise of the chest, but no more. CPR providers should avoid giving too many breaths or a large volume during rescue breathing because it can be harmful. It can force air into the stomach, causing regurgitation of food, liquids, or vomit into the airway. In the case of drowning, begin with rescue breaths. As soon as the unresponsive victim is removed from the water, open the airway and assess breathing. If there is no breathing, give 2 rescue breaths that make the chest rise.
Complete this review question to check your knowledge.
You're a trained CPR provider responding to a shout for help to assist a guest at a lakefront. Upon arrival, you see a couple bystanders dragging a limb, apparently unconscious person from the water onto the shore. One of the bystanders, catching their breath, says, "Fell off a jet ski." You have disposable gloves and a CPR mask. You tap the person and ask, "Are you okay?" There is no response. Another CPR provider is bringing an AED. The person is not breathing. What would you do? So you open the airway and use the mask to give 2 rescue breaths.
When indicated, an electrical shock passed through the chest can restore the heart's normal contractions. After completing this lesson, you should be able to identify the steps to use an AED trainer on an adult.
An automated external defibrillator, or AED, is a portable, computerized device that is simple to operate. It can identify pulseless ventricular tachycardia and ventricular fibrillation, and deliver an electrical shock to restore the heart's normal contractions. If the electrical shock is effective, there will be a return of spontaneous circulation. The heart will be able to pump blood. The person may also start breathing, moving, or reacting in other ways. AED design varies by model and manufacturer, but they all operate in a similar manner. If you have an AED in your workplace, be familiar with its operation. Opening the lid will turn on the power for some AEDs. With others, simply press the power button. This starts voice prompts and readies the device for use.
Remove all clothing from patient's chest.
Proper AED operation requires direct contact between the pads and the person's skin. Any clothing in the way must be removed. This includes swimsuits, bras, and any other clothing covering a person's chest. If necessary, cut through clothing with the shears that are typically included with a CPR and AED response kit. Locate and pull out the defibrillation pads. The pads have pictures on them to show proper placement. Peel the pads from the backing sheet one at a time and place each according to the pictures. Press the pads firmly in place. Pads must not touch or overlap each other. Avoid placing the pads over medication patches or implanted devices. Try to apply the pads within 30 seconds after the AED arrives. If another provider is present, have them continue giving compressions while the pads are being placed. When the AED voice prompts you, clear the person and allow the AED to analyze the heart rhythm.
Analyzing heart rhythm.
Be certain that no one is touching the person. If the AED advises a shock, it will prompt you to clear the person again.
Do not touch patient.
Everybody clear?
For most AEDs, delivering a shock is done by pressing the shock button.
Shock delivered.
Once a shock has been delivered, immediately resume CPR, starting with chest compressions. After about 2 minutes of CPR, the AED will prompt you again to analyze the heart rhythm.
Analyzing heart rhythm.
Follow the voice prompts.
Everyone clear.
Everybody clear?
Shock delivered.
Continue CPR and AED use until another CPR provider, someone with more advanced training, or EMS providers arrive and take over, or until the person starts breathing, moving, or reacting in other ways.
Complete this review question to check your knowledge.
You're a trained CPR provider responding to an alert from the company electronic notification system. For an associate passed out, the scene is safe. You have taken standard precautions. You see an anxious person kneeling next to the motionless adult lying face up on the store floor. You have disposable gloves, a CPR mask, and an AED. You tap the person and ask loudly, "Are you okay?" There is no response. EMS has been activated. The unresponsive person seems to gasp for air now and then. What do you do? Let's see. Let's see if that's... No. Power on the AED. Okay.
The combination of CPR and early defibrillation is effective in saving lives when used in the first few minutes following collapse from sudden cardiac arrest. After completing this lesson, you should be able to apply the CPR AED links of the adult chain of survival as one provider.
If an unresponsive person is not breathing normally or only gasping, one CPR provider can provide high-quality adult CPR by putting together all the skills of assessment, compressions, airway, breathing, and AED use. First, assess scene safety, taking standard precautions. If the scene is safe, assess the person's responsiveness. Tap the victim and ask loudly, "Are you okay?"
Hey, are you okay?
If the person is unresponsive, activate EMS or your EAP.
You have an unresponsive employee in the warehouse at 1-2.
After activating, and unless they are readily available to you, send someone to get the first aid kit and AED.
Would you mind going and grabbing a first aid kit and AED, please?
Assess the person's breathing for no more than 10 seconds. If the person is not breathing normally or only gasping, start high-quality CPR. Position the person on a firm, flat surface. Position 2 hands on the lower half of the breastbone. Perform 30 high-quality chest compressions. Use upper body weight to compress. Compress at least 2 inches or 5 centimeters. Compress at a rate of 100 to 120 times per minute. Allow the chest to fully recoil at the top of each compression. Use a CPR mask to give rescue breaths. Open the airway and give 2 rescue breaths. Ensure each breath is 1 second in length and creates visible rise of the chest. Immediately resume high-quality chest compressions. Repeat CPR cycles of 30 compressions and 2 breaths for 2 minutes. As soon as an AED is available, power on the AED.
Adult mode.
Bare the chest.
Remove all clothing from patient's chest. Apply pads to bare skin exactly as shown in the pictures.
Correctly apply the AED pads. While the AED is analyzing, make sure no one is touching the person.
Analyzing heart rhythm.
If directed by the AED, deliver a shock.
Everyone clear. Press
Everybody
flashing
clear?
button.
Press the shock button.
Shock delivered.
Immediately resume CPR, starting with chest compressions. After about 2 minutes of CPR, the AED will prompt you again to analyze the heart rhythm.
Stop chest compressions. Analyzing heart rhythm.
Follow the voice prompts.
Everyone clear. Press flashing button.
Everybody clear?
Shock delivered.
Continue CPR and AED until another CPR provider, someone with more advanced training, or EMS providers arrive and take over, or until the person starts breathing, moving, or reacting in other ways. If another CPR provider is available, take turns providing chest compressions. Switch providers about every 2 minutes, or sooner if they get tired. Try to minimize interruptions to compressions to less than 10 seconds.
Complete this review question to check your knowledge.
You're performing conventional CPR on an unresponsive visitor who collapsed outside the main building. You have taken standard precautions. EMS is on its way. The untrained coworker you sent to get a nearby AED sets it down next to you and said, "Here's an AED. What do you do?" I guess I would power it on and remove any clothing.
The combination of CPR and early defibrillation is effective in saving lives when used in the first few minutes following collapse from sudden cardiac arrest. After completing this lesson, you should be able to apply the CPR AED links of the adult chain of survival as one provider.
If an unresponsive person is not breathing normally or only gasping, One CPR provider can provide high-quality adult CPR by putting together all the skills of assessment, compressions, airway, breathing, and AED use. First, assess scene safety, taking standard precautions. If the scene is safe, assess the person's responsiveness. Tap the victim and ask loudly, "Are you okay?"
Hey, are you okay?
If the person is unresponsive, activate EMS or your EAP.
You have an unresponsive employee in the warehouse at 1-2.
After activating, and unless they are readily available to you, send someone to get the first aid kit and AED.
Would you mind going and grabbing a first aid kit and AED, please?
Assess the person's breathing for no more than 10 seconds. If the person is not breathing normally or only gasping, start high-quality CPR. Position the person on a firm, flat surface. Position 2 hands on the lower half of the breastbone. Perform 30 high-quality chest compressions. Use upper body weight to compress. Compress at least 2 inches or 5 centimeters. Compress at a rate of 100 to 120 times per minute. Allow the chest to fully recoil at the top of each compression. Use a CPR mask to give rescue breaths. Open the airway and give 2 rescue breaths. Ensure each breath is 1 second in length and creates visible rise of the chest. Immediately resume high-quality chest compressions. Repeat CPR cycles of 30 compressions and 2 breaths for 2 minutes. As soon as an AED is available, power on the AED.
Adult mode.
Bare the chest.
Remove all clothing from patient's chest. Apply pads to bare skin exactly as shown in the pictures.
Correctly apply the AED pads. While the AED is analyzing, make sure no one is touching the person.
Analyzing heart rhythm.
If directed by the AED, deliver a shock.
Everyone clear. Press
Everybody
flashing
clear?
button.
Press the shock button.
Shock delivered.
Immediately resume CPR, starting with chest compressions. After about 2 minutes of CPR, the AED will prompt you again to analyze the heart rhythm.
Stop chest compressions. Analyzing heart rhythm.
Follow the voice prompts.
Everyone clear. Press flashing button.
Everybody clear?
Shock delivered.
Continue CPR and AED until another CPR provider, someone with more advanced training, or EMS providers arrive and take over, or until the person starts breathing, moving, or reacting in other ways. If another CPR provider is available, take turns providing chest compressions. Switch providers about every 2 minutes, or sooner if they get tired. Try to minimize interruptions to compressions to less than 10 seconds.
Complete this review question to check your knowledge.
Okay, you were performing conventional CPR on an unresponsive visitor who collapsed outside the main building. You have taken standard precautions, EMS is on their way. The untrained coworker you sent to get the AED sets it down and says, "Here's the AED. What do you do?" I feel like I already had this question. Wasn't it just power on the AED? Yeah.
A CPR provider may face some circumstances that require additional considerations or tasks for effective cardiac arrest care. Act quickly if anything affects AED use to keep this link in the chain strong. After completing this lesson, you should be able to identify special considerations for the AED. Explain special considerations for a pregnant person in cardiac arrest. Describe how to give mouth-to-mouth rescue breathing to an adult.
CPR provider may face some circumstances that require additional considerations or tasks for effective care. Act quickly if anything affects AED use to keep this link in the chain strong. Thick chest hair may prevent the AED pads from adhering to the skin. If chest hair is preventing pad-to-skin contact, use the razor that is typically included with the CPR and AED response kit to quickly shave the spots where the pads will be placed. If you do not have a razor, but a second pair of pads is available, use the first set of pads to remove the hair from the skin. Apply the first set of pads firmly over the chest hair, then pull the pads off quickly. Then apply the second set of pads. Do not use an AED if the person is immersed in water. The person must be removed from water before using an AED. If the person is in a wet setting, such as lying in snow or ice, in rain, or on a wet floor or deck, or in a small puddle, it is safe to use the AED. If the person's chest is wet, quickly dry the chest before applying pads. AEDs can be used safely on metal surfaces, such as gratings or stairwells. Make sure the pads do not directly touch any metal surface when the AED is powered on. Persons at high risk for cardiac arrest may have a surgically implanted defibrillator or pacemaker. Most often, a noticeable lump is visible in the left upper chest, though sometimes the implant is in the upper right chest or abdomen. Avoid placing the AED pad directly over the implant, as the device may interfere with shock delivery. Do not place AED electrode pads directly on top of a medication patch. A patch could block delivery of the shock from the electrode pad to the heart and cause small burns to the skin. If it doesn't delay shock delivery, peel off the patch with a gloved hand and quickly wipe the area before attaching the electrode pad. If the AED pads are not in contact with metal jewelry, the jewelry does not have to be removed. Do not delay chest compressions or defibrillation for a pregnant woman. Follow the normal steps for operating the AED. The shock from the AED will not harm the baby. If the woman starts breathing, moving, or reacting in other ways, place her on her left side to improve blood flow. Resuscitation puts CPR providers at an increased risk of occupational exposure and infection from bloodborne and airborne pathogens. CPR providers should routinely take standard precautions during resuscitation, including using a CPR mask with a HEPA filter when available. There may be a rare or extraordinary circumstance when a barrier device is not available and a CPR provider is willing to provide mouth-to-mouth rescue breathing. Mouth-to-mouth rescue breathing is a form of artificial ventilation that can provide oxygen to a respiratory or cardiac arrest victim. To give mouth-to-mouth rescue breathing to an adult, open the airway with the head tilt chin lift. Pinch the nose closed with your thumb and forefinger. Take a regular-sized breath and seal your lips around the victim's mouth, creating an airtight seal. Give one breath over 1 second. Give enough air to make the chest visibly rise, but no more than that.
Complete this review question to check your knowledge.
You are responding to a call for assistance from your mobile device for a customer who fainted. You have taken standard precautions. You have a CPR mask, a first aid kit, and an AED. EMS and an EAP has been activated. Upon arrival, you find another trained CPR provider performing CPR on an unresponsive person. You power the AED and ask the first provider to stop compressing so you can bare the person's chest. That's when you see a noticeable lump on their left upper chest. What do you do? It says firmly press it over the lump. Apply the pad while avoiding placing an AED directly over the lump. I guess if you can, that's what I would do. Okay.
quick response to an opioid overdose, including administering naloxone, can prevent brain injury and death. After completing this lesson, you should be able to describe the adult CPR AED procedure for a suspected opioid-associated emergency, OAE.
I'm gonna go take 5. I've gotta use the bathroom.
Drug overdose deaths continue to increase in the United States. 70% of drug overdose deaths involve a prescription or illicit opioid, such as oxycodone, hydrocodone, morphine, fentanyl, or heroin. Opioids can cause death by slowing and eventually stopping a person's breathing. Recognizing an opioid overdose can be difficult. Signs of an overdose may include small, constricted, pinpoint pupils, changes in skin appearance and condition, falling asleep or loss of consciousness, slow, shallow breathing, choking or gurgling sounds, and limp body.
Dre, you good? You good, man? Hey, you good? Hey, you good, man? Hey, Dre. Go call 911 and grab the first aid kit and AED. There should be some naloxone in there. All right.
A quick response to an opioid overdose, including administering naloxone, can prevent brain injury and death.
Oh, chill, you're good.
Naloxone is a medication approved by the Food and Drug Administration, or FDA, designed to rapidly reverse opioid overdose. Naloxone is available without a prescription in all U.S. states, the District of Columbia, and Puerto Rico. Narcan nasal spray is the most commonly prescribed opioid reversal medication. To use Narcan nasal spray, peel back the packaging to remove the device. Hold the device with your thumb on the bottom of the plunger and 2 fingers on the nozzle. Place and hold the tip of the nozzle in either nostril until your fingers touch the bottom of the person's nose. Press the plunger firmly to release the dose into the nose. If you suspect an opioid-associated emergency, assess the scene for safety. Take standard precautions. Avoid contact with drug residue, containers, needles, and other paraphernalia. Assess responsiveness.
Are you okay?
Tap the victim and ask loudly,
Hey,
"Are you okay?"
Are you
If the
okay?
person is unresponsive, activate EMS or your EAP. After activating, and unless they are readily available to you, send someone to get the first aid kit, naloxone, and an AED.
I need you to go get a first aid kit, naloxone, and an AED.
Assess the person's breathing for no more than 10 seconds. If the unresponsive person is not breathing normally or only gasping, start high-quality CPR, beginning with chest compressions. Use the AED as soon as it becomes available. Give naloxone as soon as you can, but do not delay CPR and AED use to give it. If the unresponsive person is breathing normally, give naloxone if available. To help protect the airway, place the person in the recovery position. Regularly reassess scene safety, responsiveness, and breathing. Stay with the person until someone with more advanced training takes over or EMS arrives. If the person does not respond, another dose may be given in the same way. Narcan nasal spray may be dosed every 2 to 3 minutes if available.
Complete this review question to check your knowledge.
You're a trained CPR provider who has responded to a possible overdose in a parking lot in a bus terminal. Your EAP has been activated and EMS is on its way. You have a first aid kit, Naxalon, and an AED. The seat is safe. The person is lying face up on the terminal floor, unresponsive, and breathing normally. In the nearby vehicle, you notice tiny zip-top plastic bags and a syringe. What do? No, I don't want to pick it up. I think I would do the Naxalon. But I'd also immediately start CPR and chest compressions. Okay, Naxalon. And then put him in the recovery position. Because we know there was drug use and we don't want to touch the syringe and, hurt ourselves.
When a severe airway obstruction occurs, the person cannot get air in or out of the lungs. This is a life-threatening medical emergency. If the foreign body is not removed, the person will quickly become unresponsive and suffer a secondary cardiac arrest within minutes. After completing this lesson, you should be able to describe how to recognize and provide treatment for a choking adult.
Choking, also known as foreign body airway obstruction, can occur when a solid object, such as a piece of food or a small object, becomes stuck in the upper airway. The person cannot breathe. A forceful thrust between the ribs and up into the diaphragm can pressurize the air in the chest and pop out the obstruction. Chest compressions can also create enough pressure to expel a foreign body airway obstruction. To provide the appropriate care, you must be able to recognize the difference between a mild and severe airway obstruction. With a mild obstruction, the person can speak and cough. They may wheeze between coughs. A mild obstruction is typically cleared naturally by the person through forceful coughing. If the person can inhale and exhale, encourage the person to continue coughing. Watch for signs of the airway obstruction becoming severe. When a severe airway obstruction occurs, the person cannot get air in or out of the lungs.
Johnny, what's wrong? Are you choking?
This is a life-threatening medical emergency. If the foreign body is not removed, the person will quickly become unresponsive and suffer a secondary cardiac arrest within minutes. Signs of a severe airway obstruction include the inability to speak, a weak cough, or no cough at all. The person may make a high-pitched noise when trying to inhale or make no sound at all. They may hold their hands to the throat. Ask, are you choking?
Are you okay? Are you choking? Can I
If
help?
the person nods yes or is unable to speak or cough, act quickly. If you are not alone, have someone call 911 to activate EMS using a mobile device or activate your EAP. Stand behind the person. Reach around and locate the navel. Make a fist with the other hand and place it thumb side against the abdomen, just above the navel and below the ribs. Grasp your fist with the other hand. Quickly thrust inward and upward into the abdomen. Repeat. Each thrust needs to be given with the intent of dislodging and expelling the object. Continue until the person can breathe normally or becomes unresponsive. If the object is expelled and there is a good air exchange, encourage the person to be seen by a healthcare professional. Infrequent but serious complications from abdominal thrusts can occur. If the person is pregnant or very large, and you cannot wrap your arms around them, use chest thrusts instead of abdominal thrusts. Position yourself directly behind the person. Reach under the armpits and place the thumb side of your fist onto the center of the chest. Grasp your fist with your other hand and thrust straight backward. Try to not put pressure on the ribs. Give each chest thrust forcefully with the intent of dislodging and expelling the object. Repeat chest thrusts until the object is expelled and the person can breathe or becomes unresponsive. If the person becomes unresponsive, call 911 to activate EMS using a mobile device, or activate your EAP if you haven't done so already. After activating, and unless they are readily available to you, send someone to get the first aid kit and AED. Assess breathing for no more than 10 seconds. If the unresponsive person is not breathing normally or only gasping, remove any bulky clothing from the person's chest and immediately start high-quality CPR, beginning with chest compressions. Before opening the airway to provide rescue breaths, open the person's mouth wide. Only if you see an object, remove it with your fingers. Continue until another CPR provider, someone with more advanced training, or EMS providers arrive and take over, or until the person starts breathing, moving, or reacting in other ways.
Complete this review question to check your knowledge.
You are responding to a request for first aid assistance in the lunchroom. As you approach, you find a panicky assistant manager attempting to calm a frightened staff member who is noticeably wheezing between frequent hard coughs. The assistant manager shouts, "He's choking on a hot dog, please help him." The scene is safe. You have taken standard precautions. The facility's EAP has been activated. What do you do? Come on. Computer for some reason doesn't want to work.
The steps of assessment are crucial in all but the most minor circumstances. After completing this lesson, you should be able to describe the 5 main steps in assessment by the first aid and/or CPR AED provider for any possible emergency. Recall what to do for an unresponsive person who is not breathing or only gasping. Recall what to do for an unresponsive person who is breathing normally. Explain what to do for a responsive breathing person.
As a single first aid provider, first assess scene safety. This includes taking standard precautions. If the scene is safe, assess responsiveness. If the person appears unresponsive, tap them and ask loudly, "Are you okay?"
Are you okay?
If the person does not respond, call 911 to activate EMS using a mobile device or activate your EAP. When activating EMS, listen to and follow the dispatcher's instructions. If the person is responsive and badly hurt, looks or acts very ill, or quickly gets worse, activate EMS and/or your EAP. After activating, and unless they are readily available to you, send someone to get the first aid kit and AED. Even if you are not a trained CPR provider, bring the AED with the first aid kit in case someone arrives to help that can operate it as needed. Assess the person's breathing for no more than 10 seconds. Look at the chest and face for signs of normal breathing. Normal breathing is effortless, quiet, and regular. Weak, Irregular gasping, snorting, snoring, or gurgling sounds are known as agonal breaths. This is not normal breathing. It is a sign of cardiac arrest. Take action based on the person's responsiveness and breathing. If an unresponsive person is not breathing normally or only gasping, immediately start CPR. For adults and teens in cardiac arrest, persons not formally trained in CPR should provide compression-only CPR, with or without dispatcher assistance. Position adult or teen on a firm, flat surface. Push hard and fast in the center of the chest. Continue until trained CPR or EMS providers take over, or the person starts responding by breathing, moving, or reacting. If the person is unresponsive and breathing normally, maintain an open airway. Place an uninjured, unresponsive person on their side in the recovery position to help protect the airway. Rapidly scan the person for life-threatening conditions. Look for severe external bleeding, shock, altered mental status, stroke, chest pain or discomfort, and other life-threatening conditions. If present, immediately provide appropriate first aid. Give naloxone for a suspected opioid overdose, if available. If the person is breathing and appears responsive, obtain consent. Introduce yourself and ask, "May I help you?"
Well, I'm Thomas. Can I help you?
Yeah, please help. If the person consents, rapidly assess them for life-threatening conditions. If any life-threatening conditions are present, immediately provide appropriate first aid. If the person shows signs of shock, keep them lying down, face up. Consider performing a secondary assessment to gather more information while waiting for EMS. Sometimes the problem is obvious, such as a visible wound. Other times, you may need to ask about the person's symptoms.
Well, how are you feeling?
A symptom is something felt or experienced, such as pain or dizziness.
Do you have any pre-existing medical conditions?
Medical identification jewelry can be a vital source of information in the event the person is unable to speak or becomes unresponsive. Look for a small emblem or tag worn on a bracelet or necklace or similar jewelry containing inscribed information, such as diabetes, epilepsy, food or drug allergies, and bleeding disorders. Visually assess the person from head to toe.
Are there any other pain?
Use the DOTS acronym as a guide. Look for deformities and open injuries. Ask about tenderness and swelling. If necessary, and with consent, remove or cut away clothing to get a better look at an injured or painful body part. Provide appropriate first aid for any problems found. Keep the person as comfortable as possible. Regularly reassess scene safety, responsiveness, breathing, and the effectiveness of first aid provided. Stay with the person until someone with more advanced training takes over or EMS arrives, and pass on any information gathered.
Complete this review question to check your knowledge.
You are a trained first aid provider responding to a first aid alert received on your smartphone for a person needing medical assistance. As you approach, a bystander directs you to a person who was struck by a forklift truck that was attempting to pass by. The scene is safe. You have taken standard precautions. EMS has been activated. You have a first aid kit. The person is responsive, breathing, and holding their misshapen leg in obvious pain. You ask, "May I help you?" The person angrily says, "No, I'll be fine." What do you do? Excuse me. What do you do? Don't touch them. Don't do it without consent. That one seemed a little obvious to me. Okay, I've completed all of the adult CPR, and then I'm going to do the first aid stuff next, and then lastly the child.